ऐतिहासिक, शैक्षणिक, साहित्य व संस्कृतीची जोड म्हणजे स्मार्ट पुणेकर न्यूज.
This is the largest medical professional organization which works for the critical care specialty, critical care ICU. So all our ICU specialists are the member of the Indian Society of Critical Care Medicine, and there are almost 100 branches all over the India. We have almost 20,000 members for the ICCM, 100 branches all over India, and Pune is one of the branch which formed before the National Society formed. So it is somewhat the oldest and the most active and the most, you can say, doing the lot of academic and the trainings in Pune. Like first of the mechanical ventilation workshop for the doctors was started in Pune. So that is what the ICCM Pune. So on behalf of the ICCM Pune, we have decided to hold this event 12 years back. That is the BOB, is the Best of Brussels. Now why Best of Brussels? Because one of my friends yesterday asked me why it is not Best of Pune. So we say it is not Best of Pune, it is Best of Brussels. Because there is a one landmark critical care event for the ICU doctors happens in the Brussels since last 40 years, more than 40 years. Professor Jalvi Vincent is the one who is organizing. And the all original research and whatever the development happens in a critical care area first get presented in a Brussels conference. So what we decided, this is a brainchild of the Dr. Samir Jog and the Prayag sir, there is very limited access to the Brussels conference for our Indian intensivists. So we decided to get the best of those academic content to the Pune by the same faculty who are delivering the lectures there. And that is how this Best of Brussels came into the scenario. And let me tell you, this is one of the priority landmark event now in India for the all intensivists in India and around. We got a delegate from Sri Lanka, Bangladesh, Dubai, then your Nepal, every from where they are coming because it is a cost effectiveness. So we are making the academic available in a cost effective way and doing this. So this Best of Brussels happens every year in the first week of July for 5 days. And round about attendance is 1,000, and that's what about the Best of Brussels. So we said let's now reach to the common public. We are doing a lot many things for the doctors and the training the doctors and educating them. Why not to have some event on the you giving some briefing about sepsis or infection or common topic through this platform, and that is what the entire idea of this press conference. So please feel free to ask us a question. We'll try to give it with the best of our knowledge. We have the all eminent experienced faculties, doctors here. We'll try to answer, and this is what today's purpose of the press conference.
It kills a large number of people, almost kills about 10 million people every year, and this is one of the largest cause of mortality in the intensive care, along with heart attacks or strokes. Sepsis, again, almost about 50 million patients as per the WHO data or the surviving sepsis guidelines data, about 48.3 to almost 50 million patients get admitted into various ICUs across the world with sepsis, out of which the European data says about 25% to 28% mortality. USA has got a mortality of about 35 to 38%. India is also one of the largest in Southeast Asia, around the Asian population. India is one of the largest centers where you see that large number of septic patients are admitted. And we expect that in case if we don't take care of the antimicrobial resistance, then the mortality rate will go up and it will almost double by the year of 2050. And therefore, India is not lagging behind. Our rate also is almost at par with the Western as well as the European standards. In the Asia Pacific zone, Australia and New Zealand also has about the mortality and the sepsis prevalence about 22% to 25%. So it's a global problem which needs to be assessed, tackled, and taken care of by reducing the antimicrobial resistance.
Good morning and thank you for coming for this meeting. The whole idea of Best of Brussels was to get international reputed faculty who have done original research work in the field of intensive care medicine to come to Pune and discuss their research and present it to the community here so that the Indian audience and the Indian consultants can access this information and interact with these international luminaries. That was the idea with which Best of Brussels was started. The topic for this morning is sepsis and antibiotic resistance. Now, sepsis means an infection which produces its effects on various organs and therefore threatens life. That is the definition of sepsis. Now, sepsis can be controlled only if you have agents against this infection. Now, against the bacterial infection, we know that there are antibiotics. Against the viral infection, we have antiviral agents. And against other organisms like rickettsia and other protozoans, we have some antimicrobial agents. So this is what, this is how the medical field tries to approach the problem of infections and its complications.
So this AMR is because of excessive use of antibiotics, and the strategies so there are various stakeholders. So the stakeholders are the government, the stakeholder is the pharma industry, the stakeholders are the doctors, and the stakeholders are the patients. Everybody has to come together. So what is the government's responsibility? The government's responsibility is that they have to enforce legislation that people can't buy antibiotics just off the counter. Nowadays, what is it? You go to the pharmacy and you say, I'm having a sore throat, give me an antibiotic, and they can buy it easily. That should not happen. Or the pharmacist itself can give them key, or patient can just buy. And if you go to foreign countries, you know that you can't just buy antibiotics like that. So the government role is legislation so that antibiotics cannot be sold easily. Pharma industry also has an important role to play, because they also have to educate doctors, because that they should not be using, they should use antibiotics widely, because sometimes they keep on promoting antibiotics. Then doctors also have that responsibility to prescribe, and therefore societies like ISCCM or like our infectious disease societies are constantly educating doctors about rational use of antibiotics, and this meeting is doing that.
See, what the clinician, it begins from the society, that means the general practitioners, and then it comes to the hospital. So if you look at the clinicians, they should not be prescribing unnecessary antibiotics for every infection, because many infections, I say viral infection. In that case, if you give antibiotic, you're going to harm the patient rather than help him. Secondly, when the patient comes to a tertiary care hospital like where we all work, unnecessary use of antibiotics, de-escalation of antibiotics. That means once you have the cultures positive, then you need to stop the antibiotics which are being given unnecessarily, which can be cut down. This all will reduce the antimicrobial resistance. We should have, every hospital should have an antibiotic stewardship program, which should be strictly followed. Every hospital, every few years, based on their own infection, should have their antibiograms, and they should have the recommendations in which disease to give what and for how long. Unfortunately, in India, this all is not being strictly followed. So we need to get more discipline, because we are the capital of the world's antimicrobial resistance. Nothing to be proud of. Cricket, you've done well, be happy, but don't feel happy about this.